Welcome to the Explainer. Today we're going to crack open the brain's medicine cabinet, so to speak. We're going to look at two really powerful types of medication and figure out how they work to rebalance the very chemistry that, well, shapes our entire reality.
You know, for millions of people, that question isn't just some deep thought experiment. It's their day-to-day reality. And the answer? It often comes down to medications that work deep inside the brain, fine-tuning the very signals that make up our thoughts and feelings. So we're looking at two totally different challenges here. First, you've got psychosis, which can feel like a complete break from what's real. And then there's severe anxiety, this overwhelming, constant state of worry. And as you'll see, they come from different chemical imbalances in the brain, so they need completely different kinds of solutions.
All right, so here's our game plan. We'll start with how the brain signals can get out of sync. Then we'll get into the two main types of pills for these two problems. We'll look at the showdown between old and new antipsychotics, then jump over to how anxiety meds work to soothe the system. And we'll wrap it all up by talking about what is, really, the ultimate balancing act.
Okay, first things first. Before we can really get our heads around the treatments, we have to understand the problem itself. And it all starts with the brain's communication network, which is, just unbelievably complex and super high speed.
Right, so these communicators in the brain, they're called neurotransmitters. The best way to think about them is like tiny chemical text messages. They're just zipping from one brain cell to the next, carrying all these crucial instructions that control, well, everything, from your mood to how you move.
And the journey for every single one of those messages is this incredibly precise four-step dance. First, the message gets made. Then it's shot across this tiny gap. It's called the synaptic cleft. The next cell catches it, and then boom, it's cleared out to make way for the next message. If you mess up any one of those steps, the whole system can get thrown way off balance.
And that brings us to the two absolute stars of our show today. First up is dopamine. It's usually linked to things like motivation and feeling good, but get too much of it, and that's associated with psychosis. The other one is called GABA. Think of GABA as the brain's main brake pedal, its #1 calming signal. If you don't have enough GABA, things can get, well, pretty anxious.
So, okay, we've got two different problems on the table. Way too much dopamine activity and not enough GABA. It only makes sense then that science came up with two very different kinds of medication to tackle them.
All right, so for psychosis, doctors use what are called antipsychotics or neuroleptics. The whole point of these drugs is to basically turn down the volume on those overactive dopamine signals. The goal is to help clear up that static, the disorganized thoughts and perceptions that come with it.
Now, for severe anxiety, the strategy is pretty much the exact opposite. These drugs, called anxiolytics, don't block a signal. Instead, they give a boost to the brain's own natural calming system. They make the GABA that's already in there work even better.
Okay, let's zoom in on antipsychotics for a minute. How in the world do they actually turn down that dopamine dial?
Well, they're what we call dopamine antagonists. Here's a way to picture it. Imagine the brain cell that's supposed to receive the message has all these little parking spots, or receptors, just for dopamine. What these drugs do is they swoop in and take up those parking spots. They physically block dopamine from landing, so it can't deliver its chaotic message. Pretty clever, right?
But, and this is a big but, here's the catch. Dopamine isn't just about thoughts and feelings. It's also a huge player in controlling our movement. So when you block it, you create this really serious trade-off. It can lead to some incredibly tough side effects.
And it was this exact problem, how do we treat psychosis without causing these awful movement issues, that really kicked off a whole evolution in drug design. It led to this kind of showdown between two different generations of these drugs.
And you can really see the difference right here. The first generation drugs, the typicals, they were kind of like a sledgehammer. They just strongly blocked dopamine. It worked for the psychosis, for sure, but the risk of those movement side effects was super high. The second generation drugs, the atypicals, are way more refined. They block dopamine a little more gently, and they also hit another target, serotonin. This means they can treat a wider range of symptoms, and thankfully, with a much lower risk of those side effects.
So, there's a clinical name for these movement side effects: extrapyramidal syndrome, or EPS for short. And it's a direct result of what we were just talking about, blocking dopamine in the parts of the brain that are supposed to be coordinating how we move.
And let's be clear, these issues can be just debilitating. We're talking about things like tremors and rigidity that look a lot like Parkinson's disease, painful muscle spasms, a really distressing can't-sit-still kind of restlessness, and even involuntary movements in the face and tongue.
And that last one I mentioned,
tardive dyskinesia, is especially serious. And get this, the number is pretty stark. Up to 30% of patients who were on those older, typical antipsychotics for a long time ended up developing it. And the scariest part, it can be permanent, even if you stop the medication.
Okay, let's totally switch gears now. Let's talk about the other side of the coin, calming an anxious brain. Here, the goal isn't to block a signal, it's actually to turn one up.
So the main group of these drugs, benzodiazepines, they work in a completely different way. They don't block anything. Instead, they latch onto GABA receptors and make them more sensitive to the GABA that's already floating around. It's kind of like turning up the volume on the brain's natural off switch. It just makes it so much easier for the brain to chill out and get to a state of calm.
But, and this is so important, this incredible power comes with a really critical warning. The brain gets used to this extra help, this enhanced calming effect, and it gets used to it fast. So if you stop the drug suddenly, the whole system is thrown out of whack. This can cause a massive rebound of anxiety, agitation, even seizures in some cases. It's serious business.
So when you put it all together, you can see that treating these conditions is so much more than just, writing a prescription. It's a really deep, ongoing partnership between the doctor and the patient.
You see, the ultimate goal is always to find that perfect, delicate balance. It's a constant process of calibration, asking, okay, how much relief are we getting from the symptoms versus what's the price we're paying in side effects? And the whole point of that whole balancing act is just one thing, helping a person get their quality of life back and live it to the fullest.
And this ongoing search for better, safer treatments, it really leaves us with one last big question to think about. As we keep mapping the brain with more and more detail, is the future going to be an even more precise drug, like a super specific chemical key? Or is it going to be something else entirely, something we can't even imagine right now?